Hi, my name is Mike. I'm a law student studying health policy, and we've all been pounded over the head with certain statistics, like the amount we spend in this country versus the results we get as compared to other countries. Some stats I've seen have shown that the administrative costs of the government programs are much lower than those of the private sector. So my first question is, what's the government doing right that we are doing wrong? And the second question has to do with the public relations Senator Frist just talked about. He had a slide up that said something about individual mandate, personal responsibility versus socialized medicine. And I think we've got a bunch of nurses outside running around saying, we're all in it together, or every man for himself. And I think they win that debate. And every couple of months, we're seeing some national news story about some young woman being denied a liver. How do we win? How do we preserve our space going forward?
Two big questions. The first is what is the government doing right in administering programs if the industry's not, the insurance industry's not? Anybody?
I think it's the one who ran the
We did a lot of things right. The government is able to control prices just because they are the final arbitrator. And when you're the benevolent dictator, you can pretty much determine what the prices are going to be. So we set the cost of reimbursement, and there's no arbitration or no appeal from that. And so that's easily. The second part of what we're doing right is that when you have that big of a system and it continues year after year without making that many changes, you become fairly efficient at it. And that is why the Medicare system actually costs less than the private system.
But it doesn't always produce the best results. I mean, and we used to sit in the finance committee in the back room every year and determine whether oxygen suppliers were going to get a 0.08% increase or a 0.9% increase in their reimbursement rates. I mean, here we were making these decisions and not really, I think, having the capacity to know whether it should be a 0.08 or 0.25% increase. We were fixing prices. And while the government can do that very well, I'm not sure that it produces the best results. That doesn't produce competition. It's the antithesis of competition. And it doesn't produce innovation and new ideas. So when the government can do some things well, there are other things that I think overlap that they do not do very well. So that's why you have to have a combination of what both do best.
You know, I think it's a great question. The government does a huge amount of right. The debate that we have, and the fork we have right now, is do we want a lot more government or do we want about the same or less? With the Democrats, they'll pick up seats in the Senate and in the House, put the presidential election aside. With that, there's going to be, absolutely, we can leave here and say there's going to be a lot more government in your lives, period. Period, regardless of who wins the presidential race. Is that good or bad? It depends. Obama says government's going to offer a health care plan, like a Medicare plan, out there to everybody who can't get a health care plan today. That can be very expensive. How do you control that? What is government do right today? If you look at National Institutes of Health right now, the fact that every year we add a month of life to you. If you're born in 1 year or then the next year, a month is going to be added to your life. Is that government? It's not government with a program, but it's government as an enabler. It's the fact that we have a government that puts billions of dollars into the National Institutes of Health, that comes up with unbelievable discoveries today that make my own profession of heart disease, the incidence of heart disease, fall in half just over the 20-year period I was practicing heart surgery. So government does a lot. And I don't know who's outside, but if anybody's outside advocating for a single-payer system, there was not a serious presidential candidate or a Canadian system or a European system, a German system. There was not a presidential candidate today arguing for a single-payer system or a Canadian system or a European system today. So if that's what they're arguing, I think they're totally out of tune with American people. You can reach equity, and you can actually say it's a social good without having a single-payer system.
Sheila, can I just a couple words after what Senator Frist said. The single-payer system, we have the best of both worlds. You travel around the world like all of us have up here, and you will find that no country is really satisfied with their system. You can't find that many countries stand up and say their system is best. They're looking to America to make some change. They may never go as far as we do. That's number one. Number two, if you like innovation like I do, I've got a mother-in-law that died of breast cancer, a wife that had breast cancer, my young daughter just has it. I want a cure for breast cancer, and I don't think I will ever get that under a one-payer system. I want the new drugs, the new therapies. In the United States of America, 78% of the new drugs are coming in because of the United States free enterprise policy. To me, that's worth saving.
We have just a few minutes left in this session, and we're not going to get to other questions because I would like to spend a little time on the second question that our last questioner asked, which relates to your point, Senator First, about ethics. Essentially, when denial of service becomes political, the insurance industry loses that political debate. How does one address that? How should one address questions that really get close to rationing? Is there enough health care to go around, and how should the system deal with those decisions about who gets it and who doesn't?
Well, let me jump in. People say, why are these healthcare costs going up 2-3 times faster than wages or inflation over the last 40 years? Why is this 2.5% rule where GDP is X%, but healthcare goes up 2.5%? And it's really two reasons. First of all, we're a rich country. And if you've got more money just as an individual, you are going to spend more money on what you value, and you probably don't value anything more other than your family than health. So you're just going to spend more. And the other is technology. Right now, we can do heart and lung transplants, and we can do arthroscopic back operations, and it is wonderful that we can do that. And my wife could have back surgery as an outpatient that 10 years ago, you'd be in the hospital for 9 days. That sort of progress we don't want to slow down, but we are going to have to ration for those two reasons. So do we ration just as a consumer good, and if so, what is the role of government to level that playing field? Or do you ration as a social good, which basically means long waiting lines, frustration from the consumer, which means even in America, you're not going to be able to get what you might want to get because of the government. And that's where the argument is today. And there is a middle ground. And I think, I know we got to finish here shortly, but hopefully what you've heard from us, the presidential races are very, very important. But what goes on in that co-equal branch of government, the United States Senate and the House of Representatives, can be equally important, and that may well be where most activity or a call for centrist bipartisanship can have its biggest impact.
Well, from a rationing perspective, you have rationing now. It's not official. I mean, it's not a government dictate that it's going to be rationed, but you get different categories of health care depending on your status in life. If you're insured, you get one. If you're uninsured, you certainly have a different quality and a different standard. Your health care is rationed differently than if you had insurance. So the goal of getting everyone insured obviously is also part of eliminating any rationing aspects of health care delivery in this country. I think the word I would leave with you all is that I think Congress is going to do something, but don't wait. I mean, this is a problem that cannot be solved just by Congress. And I think that you all in this industry have an incredible capacity to influence behavior by requiring certain standards and certain things to be done before you're willing to insure them. We know the solutions. The question is, how do you get them enacted? Information technology, of course. Wellness programs, of course. Preventative health care, of course. Prescription drugs being automatically prescribed electronically, of course. Those are all part of the answers. But if we're just going to wait for Congress to get all that done, we may never see it happen. But I think you all can greatly influence the behavior of all of these suppliers by saying we're going to insure these specific type of programs. And that would be so encouraging if y'all could move in that direction.
I'm sorry, I have to bring this panel to a close. It's been so interesting. I will give you the last word to be very brief.